Welcome to AM News.
Thank you.
Now, Doctor, what exactly does the report say?
The report is basically saying that, in fact, this region of Eastern Southern Africa is making quite some significant progress in both reducing new infections, reducing HIV-related deaths, and keeping people alive. And essentially, this is the region that, if you recall, has always been seen as the epicenter of the AIDS epidemic. It still remains the epicenter of the epidemic. But the progress that countries in the region are making has been quite remarkable. We've been able to put, or at least initiate, about 6.3 people on treatment. This is a 10 times fold from where we were in 2005. So there is quite some significant progress that's going on in the region.
Yes. Now, Doctor, what was the reason behind the commissioning of this report?
Well, this is a report that we produce annually, but we usually produce a global report. This time we decided to have a regional-specific report so that we can focus on what is happening in the region and also generate the kind of dialogue that we need to have at country level, looking at the progress that countries are making and also looking at the challenges that countries need to resolve if we are going to meet some of the global targets that the international community has set for itself.
Yes. Now, Doctor, what made the HIV programs for the southern countries much more progressive other than the other countries in the African continent?
I think if you recall, I think for quite some time, I think we're quite slow off the block in terms of what we needed to do. But over the past few years, 5 years or so, we have seen quite some significant progress. And most of that has been largely because we have the political backing for some of these national programs, but also because we have had a very vibrant civil society movement that has actually tried to push the envelope for us to move into those programs, but also because we also have had enormous international solidarity from the Global Fund, from PEPFAR, who have provided some of the essential resources that are needed by some of the countries. In fact, some countries are mainly dependent on some of these funding sources for them to make the progress that we are making.
Now, Doctor, with that said, are you planning to implement the same system to other African countries as it works in the Southern Hemisphere?
I mean, certainly we are responsible for the Eastern Southern Africa country. We have other two regions for Africa, Eastern Central Africa and also the North Africa region. But for our region, we think that countries are making good progress. But I should also say that there are enormous challenges ahead. I think we have to be very clear about that we need to make sure that, in fact, countries that, in fact, are not making the same level of effort, particularly around reducing new infections, needs to be supported to doing so. But we also have, challenges within our health systems that we need to address.
What could those challenges be, Doctor?
Some of the challenges, for instance, have to do with the fact that, in fact, if you look at the disease burden in some of our countries, it's enormous, and you are adding this on top of, in fact, health systems that are already burdened by the other, health imperative that they have to respond to. So going forward, I think we need this region to continue to stay focused, to innovate, because we need to innovate and find better ways of delivering services so that we can continue to make progress.
And Doctor, last but not least, what are the recommendations stipulated in the report?
I think the recommendations that we have is that the region should stay focused. But I think that the region should be looking also at regional solutions. In fact, that we innovate collectively, particularly around issues of harmonizing, protocols for treatment, for regulations, because the region is intertwined. We have a very mobile population in our region, particularly in the eastern, in the southern part of the continent. So we are looking forward to have this region adopt new evidence much faster, implementing new evidence of what works much quicker than we have done before, and also making sure that, in fact, we deal with the issues of stigma, we deal with issues of human rights, so that people can actually access services that they need to access.
Thank you so much, Doctor, for your time. That was Dr. Mbulawa Mugabe, the Deputy Director of the UNAIDS Regional Report on HIV and AIDS. Now, Tsietsi Munare is standing by with a complete weather update.